of your Zoom screen. We've put instructions in the chat. While we meet today on a virtual platform, I would like to acknowledge the importance of the land on which we call home and acknowledge the First Nations, Métis, and Inuit peoples of the land that we are on today. CCOHS is on the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and Anishinaabeg to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and the Mississaugas of the First Credit Nation. We are here with our national partners, Eugene Gutierrez, Executive Director of Threads of Life, and Dave Turner, President of Health and Safety Professionals Canada, as well as our special guest, Sandy Prong, who is a family speaker from Threads of Life. Thanks for joining us today. We're pleased to have participants from all across Canada. This week, we celebrate our collective commitment for creating safer and healthier environments for everyone. It's also a time to reflect on the importance of safety and health in our workplaces, our homes, and our communities. Workplace health and safety goes beyond policies and regulations. It's about fostering a culture where every individual feels valued and protected. It's about recognizing that everyone has the right to be safe at work, safe from physical harm, harassment, and violence, and from bullying and negative behaviors that affect our mental health and well-being. As we embark on this week, let's remember that health and safety is a journey that requires continuous effort, vigilance, and dedication from all of us. It involves being proactive, identifying hazards, assessing risks, and taking steps to protect workers from harm. It's about creating environments that support the mental and physical well-being of individuals and understanding that a healthy workforce is a productive workforce and a healthy community is a thriving community. Let's commit to making safety and health a priority and engage in meaningful conversations, share best practices, and learn from one another. Let's celebrate the progress that we've made and face the challenges that lie ahead. By working together, we can create a lasting workplace culture that extends beyond this week. Let's inspire each other to take action, remain vigilant, and look out for one another. Thank you for being here today and for your dedication to safety and health. May this week be memorable, filled with learning, growth, and positive change. I'd now like to turn it over to Dave Turner, the President of Health and Safety Professionals Canada, to share a few words.
Thank you, Anne. Good morning. I love Safety and Health Week. I look forward to this kickoff every year. Health and Safety Professionals Canada is pleased and honoured to partner with CCOHS and the Threads of Life in delivering the startup to Safety and Health Week. Thinking and talking about safety and health is important at all times throughout the year, but this week is set aside so that we can all come together nationally to think about how we can work together to ensure everyone gets home safely. There are too many injuries and, unfortunately, fatalities occurring in the workplace, and it behooves us to take every step we can to reduce these outcomes. Managers often think that safety is about compliance with rules and regulations. And while that's important, since every rule and regulation was written because of someone becoming badly injured or even killed, we must not think of it as only that. Safety is much more than compliance with rules and regulations. It's about people, their working conditions, their attitudes, their physical and mental states. More and more today, we hear of workers with anxiety and stress. overwhelmed and overworked, which leaves a heavy weight on their mental capacities. We are our brother's keepers, and we should be constantly watching for any signs of stress within our colleagues. Interventions are key to ensuring safe work situations, whether people are performing jobs incorrectly or appearing disconnected. Interventions are not easy the first couple of times you do them, especially if you fear being rejected. But with practice, they become easier and second nature. You don't have to be rude. A simple question is enough. Could you tell me why you did it that way? Would this way have been safer? Don't get discouraged if you're told to get lost, or words to that effect. Not everyone welcomes help. Out of 100 interventions, I may get 1 or 2 rejections, but that means we made 98 tasks safer. I'll give you a little bit of information about Health and Safety Professionals Canada, which was previously the Canadian Society of Safety Engineering. We rebranded and renamed ourselves 2 years ago, since some of our members were emphasizing that they were not engineers or performing engineering functions. We also formed 6 regions coast to coast and an international, region. Quebec has also been formed into a separate region, and we are in the process of translating documents and our website into French so that we can include francophones in Quebec, New Brunswick, and of course the rest of Canada. We hold networking and educational sessions in communities across Canada. As part of our networking and educational activities, we hold an annual professional development conference. This year it will be in St. John's, Newfoundland in September. You can find details on our website, which I will add to the chat later on. Safety and Health Week is a time when companies and employees get to set up special classes or special events to enhance and encourage awareness and participation, so that we can create workplaces and communities where everyone can feel safe. Health and Safety Professionals Canada has lunchtime online speaker sessions every day this week, open to members and to the public. Each day is set up in a different region. Today is for Alberta, tomorrow is Quebec and Ontario, and then the rest of the week. Anyone can join in, so check our website for times and subjects. I encourage you all to get involved in this week's activities, and whenever possible, get involved in your local communities throughout the year. Volunteers are needed everywhere to ensure that safe and healthy workplaces are the norm, not the exception. I'll leave you with this thought. First and foremost, safety is about people, their well-being, their livelihood, and their life. Though it's important, compliance to rules and regulations is secondary. Thank you, and enjoy your Safety and Health Week. Back to you, Anne.
Thank you very much, Dave. Really appreciate you sharing your perspective with us and getting Safety and Health Week off to a great start. We appreciate the expertise and efforts of health and safety professionals who help make workplaces safer. Our next guest is Eugene Gutierrez, the Executive Director of Threads of Life, also a national partner in Safety and Health Week. More importantly, Threads is an organization that offers much needed support to families who have experienced a workplace tragedy. Eugene, over to you.
Great, thank you for the warm welcome. And I'll just take a moment to switch over to my presentation. Okay. So first and foremost, good morning, everyone. I want to say how honored Threads of Life is to be a national partner for Safety and Health Week. We're also very deeply grateful to our friends at CCOHS for inviting us to be part of this special virtual event. It's a privilege to join you today as we launch this year's Safety and Health Week, a week that reminds us of something simple yet profoundly important, that every worker deserves to come home safe and healthy every day, no exceptions. This week across Canada, we take time to pause and reflect, to recommit. We look at how far we've come in building safer, healthier workplaces, and we acknowledge that there's still work to do. Because real health and safety, it isn't just about ticking boxes or posting signs in a break room. And it's not only about hard hats or harnesses, though those are essential. It's not just about doing a job right. It's about doing it responsibly, doing it together. True safety culture is rooted in people. It's grounded in care. It's in the quiet everyday choices we make to look out for one another, to speak up, to take that extra moment to make sure everything and everyone is okay. For me, when I think about Safety and Health Week, the week serves as a time of remembrance, a time of grief, a time of love. Over 7 years ago, my father bought a mining surveyor, went to work, and he never came home. He died in a workplace incident, like so many, was entirely preventable. And I carry that moment with me every day. The shock, the silence, the ache of some questions that will never fully be answered. But I also carry something else with me. I carry his story, and I carry the stories of many other families and workers across this country. Families who've lost mothers, fathers, sons, daughters, families who've been forever changed. And that's why I do this work. That's why I'm proud to lead Threads of Life, an organization that exists to walk alongside those impacted families and workers, to offer hope when it feels like all hope is gone, to build that community of healing, of strength, and of prevention. And I want to take a moment to say thank you to all of you, to the safety professionals who make the hard calls, to the workers who speak up, to the employers who invest real, lasting culture change, to the unions, the educators, the leaders. Each and every one of you are helping shape a world where fewer families and workers have to endure what mine did. Now, I would be remiss to not address an issue that is becoming increasingly important in the conversation around workplace health and safety. Safety isn't just about physical risks. It also includes mental health. It's about the stress that builds quietly, the fatigue that wears us down, the trauma that follows some of us home. It's about asking, how are you really? And taking time to listen to the answer, because we can't separate safety from wellness. We can't talk about physical protection without also talking about emotional resilience. And we can't be fully safe until everyone feels seen and heard and valued. So as we mark this week, I ask all of us to think a little bigger. Let's think beyond compliance. Let's think beyond policies. Let's think about people. Let's think about compassion. Let's think about the kind of culture we're creating on the job and in our communities. Let's ask, are we creating environments where people feel safe to speak up? Are we watching out for one another? Not just because we have to, but because we choose to. Because in the end, that's what this is all about. It's about love. It's about dignity. It's about humanity. So as we move forward from this week, let's honor the memories of those we've lost. Let's keep striving for those still with us. Let's keep building workplaces and a world where safety is not an afterthought, but is a way of life. And let's remember this. Every life matters. Every choice matters. And safety, that simple, powerful act of care, is how we show each other that we matter. So on behalf of Threads of Life, thank you for all that you do, and thank you for your continued support. We are deeply grateful to the many organizations and Safety and Health Week partners who make space in their plans to share the stories of those who've experienced the devastating consequences when health and safety are not prioritized. At this time, I'd like to introduce you to Sandy Prong, a Threads of Life volunteer speaker, to share one of those stories. A story that puts a human face to the consequences and reminds us all of our shared mission to prevent future workplace tragedies so that no family or worker has to experience what Sandy and her family have faced. Please welcome Sandy.
Thank you. Thank you, Eugene. And good morning, everyone. I'll just share my slide here. Okay. On April 29th, 1980, I woke up yelling my brother's name. I looked out the window and I saw my mom and my brother pulling out of the driveway. She would take him to work in the morning, and later that day I would pick my brother up from his work site. And that was our routine, but not on this day. In 1980, I was a teenage girl. I was the youngest of three. You may be asking yourself how an over 40-year-old story has relevance today, but I am the aftermath of a workplace tragedy that was preventable, not inevitable. On February 1st, 1952, my brother Gregory Alec Daw was born. And he was the firstborn, as the evidence is clear with all the hundreds of photos of him, and yet you'd be hard-pressed to find many photos of my brother Brad or I. My parents were both very social and active. They loved hockey, golf, curling, bridge, and pretty much in that order. My dad, an avid hockey fan and player, had both my brothers on the ice by the age of 3 in training to be in the NHL, of course. Greg was athletic. He was a great hockey defense player. He was a lacrosse player. He played football for his high school, golf. He was even a lifeguard at a local wading pool during his teenage years. Following high school, Greg went off to college, and unfortunately he contracted mononucleosis, and he was so sick he had to drop out. Shortly thereafter, he and his free-spirited nature took him out to British Columbia. And as it turned out, while he was there, Greg met a girl and they had a daughter together. The relationship unfortunately didn't last, and Greg returned home. When he came home, he secured a job in a retail store. So that's right, we dressed up this guy in a suit and off he went. But he actually was quite successful. He won a customer service award and became the store manager in no time. It wasn't surprising. Greg was a true people person and a super smart guy. He was always the magnet in the room. People just seemed drawn to him. However, if you were to run into him in a dark alley late at night, you might be a bit intimidated by his presence. He was a character. He loved to have a good time. His friends nicknamed him Potsy, and it stuck with him, so much so that they later started calling my other brother, Brad, Little Pots. I watched one time when Greg came into a local restaurant establishment, and he walked in by himself and he said hi to almost every person and knew their names. He sat down at a table by himself, and within seconds, he had a crowd with him. Greg also had a natural talent for music. He could carry a tune and played electric guitar and was self-taught. I often think that maybe music would have been a constant in his life. He might have been playing in small bars all across Ontario and loving it. On April 12th, 1978, our family actually suffered our first tragedy. My father died. My father was only 54 years old and he had cancer, and it took him very quickly. It was a scary, sad, and uncertain time for us. You see, he was the breadwinner, and my mom hadn't worked in 35 years. She had been a homemaker and had to rely on 35-year-old secretarial skills to get out there and get a job, which she did. At this time, Greg decided he wanted to go back out west to give things another go with his love and his daughter, which was understandable but very difficult for us at this time. Once again, things didn't work out, and Greg returned home about a year later, and he wanted to surprise my mom. So he was there waiting in the front hallway when she arrived home from work. Greg discovered during that time he had worked in retail wearing a suit that he didn't love it so much, and so he pursued a job in the outdoors. He started working for the region of Peel. That April, Greg had spent much of the week working in torrential rains. He would come home covered head to toe in mud, and me, all of 17, proclaiming he shouldn't be working in those conditions. When I arrived home that day, I got down to getting ready to go pick Greg up from his work site. My mom mentioned to me that apparently the police were looking for him. I didn't think too much of it. I jumped in the car and headed down to get him. But about 5 minutes in, it just wasn't sitting right, and I turned around and I went back home. When I arrived home, there was a police cruiser and another car I didn't recognize sitting in the driveway. When I walked into the living room, I saw the police officer with our church minister. And then I heard it. Greg had been killed that day at work. It was beyond unbelievable. We just lost my dad 2 years earlier. This just couldn't be happening. I couldn't bear it. I ran out the door. I ran through our local park. I punched a light post. I was angry and crying, and I was gone for about a half an hour. When I returned home, my brother Brad and his wife were just arriving. I'm ashamed that I abandoned my mom in this most horrific moment of her life. And then all the people started to arrive. Neighbors, friends, family, everyone coming to kindly offer support. My mom encouraged my two best friends to spend the night with me. No one would tell me what happened to my brother that day at work. I don't think that I really wanted to know, but my friends let it slip. I couldn't imagine the horror Greg faced while spotting for a bulldozer, trudging in 6 inches of mud. He slipped and fell while the bulldozer was reversing. He was crushed. He died instantly. By this, all 44 tons of it. A split-second decision, a loss of focus around others, a need to push work ahead in poor conditions has consequences forever. That very day, it was reported that Peel Council was debating the operation of that very worksite and whether or not it should be regional staff continuing to operate it or if it should be subbed out to a private contractor. Upon hearing of my brother's death, the decision was made immediately to sub out all earth-moving equipment to a private operator. But it was too late for Greg. My mom couldn't attend the inquest. She just couldn't keep the tragedy close and talked about. My brother Brad attended. To this day, he won't discuss it. We have, as a family, never sought support of any kind. You see, back in the 80s, psychotherapy, support groups, not-for-profit organizations like Threads of Life just weren't commonplace. When my brother passed away, my mom had him buried next to my dad. There had only ever been a small ground plaque with the last name Daw on it to mark where he was buried. Several years later, I was able to install a larger black granite marker to honor his burial site. And having recently found the courage to request the coroner's report, because I had never asked for it, I don't think I really wanted to see it, and I certainly wasn't privy to the information from the inquest at the time. My husband insisted on reviewing it first before letting me review it, and he was horrified by what he read. And he is a retired 32-year firefighter and had witnessed many horrific scenes throughout his career. Eventually, I found the courage to go through it, as difficult as it was. The key things I wanted to focus on in the end were the recommendations of the coroner. The first thing was that there should be training for spotters, which emphasize the risks and identifies the dangers of the job. Secondly, the bulldozer should be equipped with a backup warning device or beeper and a flashing light on top. And thirdly, there should be radio communication between the spotter and the bulldoze operator. It's hard to imagine that these weren't viewed as necessities at that time. Hopefully, the inquest recommendations at the time or versions thereafter have gone on to reshape the landscape of workplace safety and prevent, at very least, some similar accidents. However, there have been many reports developed around struck by accidents in the workplace. The results, which really lay out the requirement for limited or avoidance altogether of reversing equipment where there are blind spots. In 1979, the Government of Canada launched Workers' Basic Rights in Canada, so just 1 year prior to Greg's death. I'm certain Greg wasn't aware of these at the time. Workers do have the right to know what hazards are present in the workplace, the right to participate in keeping their workplace safe and healthy, and the right to refuse work that they believe to be dangerous to themselves or their co-workers. I believe we've come a long way since 1980 when it comes to workplace safety. Sadly, we've learned and evolved through the tragedies of the past. Greg didn't get a chance to live his dreams, to be a father, to see his daughter graduate, get married, have a child of her own. He didn't get a chance to grow his love of music into anything. He didn't get a chance to be one of you, still here, still working, still living, embracing family. You never knew Greg, but hopefully a piece of his story will remain with you, especially if you encounter a workplace situation that may be uncertain or unsafe. Grief has no expiry date for those affected. It remains in various stages long after funerals, court proceedings, inquiries, and media coverage. Whether we endured losses through illness or tragedy, the pain and sense of loss in our lives is not something to be overcome. We simply find the resilience to survive after those who have gone before us. All of us here will experience grief at some point in our lives, but for those tragedies that can be avoided with an effort on care and an investment in training, education, proper oversight, and the use of advanced technologies and personal ownership as an employee, perhaps we can lessen this burden of grief for others. Thank you. Thank you for allowing me to share my brother's story.
Sandy, thank you for sharing yours, your mother, and Greg's story with us. It really is a painful reminder of the rippling impact that one catastrophic injury or illness can have on loved ones, friends, and community. Your story motivates us to continue our work with the hope that one day these life-altering tragedies can be prevented. And thank you also, Eugene, for your remarks about Threads of Life and the role that it plays. So this takes us to the final and one of the highlights of the program. We finally find out who takes the prize in the National Youth Video Contest. So this year we had 10 videos submitted from the provinces and territories, and that's a new record. Each one was insightful and imaginative with excellent safety messages. Once again, the talent of these young people did not disappoint. And if you haven't already, I encourage you to watch the whole playlist of entries on the CCOHS YouTube channel and view them for yourself. So we're going to start by showing you the third place winning video entitled Your Well-Being Matters at Work.
It's exciting starting a new job, but did you know that young and new workers are the most likely to get injured on the job? Workplace safety is the law, and knowing your rights can help keep you safe. Your employer must make sure that your job isn't dangerous. If something feels risky, you have the right to say no until it's fixed. You should never have to guess how to do your job safely. Training is important. Even in a safe workplace, hazards can still appear. Let's identify some common ones. Spills happen, clean them up right away or report them to prevent slips and falls. Lift smart, not hard. Bend your knees, not your back, to avoid injuries. Safety gear is your best friend. Always wear the right protective equipment like safety goggles, gloves, or helmets. Hazards can be everywhere, but knowing how to handle them keeps you safe. Why does safety matter? Because one small mistake can lead to big consequences. Accidents can happen in an instant. That's why it's important to follow safety rules every time. Safety isn't just about you. It's about protecting everyone around you. Work hard, but don't forget to take care of your body. A little self-care goes a long way. Stay safe, speak up, and remember, your well-being matters at work.
And I'm very happy to award our $1,000 third prize to Mika Sofia Del Mundo from London South Collegiate Institute in London, Ontario. Mika's school will also receive a matching prize. And well done. Let's take a look at our second place winning video, I should say, entitled Stay Safe and Informed.
At work, staying safe and staying informed can be your biggest tools in preventing workplace incidents. Here are 3 things to remember to ensure the safety of yourself and others in your workplace. First, as a worker, always remember that you have rights. Say you've been asked to use an unsafe ladder at work. You have the right to say no, refusing to use the unsafe ladder. The right to know previous incidents on the ladder or ladder instructions, and the right to participate in picking a newer, safer model, reporting the use of unsafe equipment, or joining a local safety board. In your workplace, you'll find hazards. Knowing and identifying these hazards help you prevent any injuries from happening. The single most common and most dangerous types of hazards are slips, trips, and falls. These are things like puddles, debris, and uneven walking surfaces. Furthermore, noise levels and vibrations, electrical dangers, heavy lifting, and poor posture. But workplace hazards aren't all physical. Mental health hazards are often overlooked and stigmatized. Depression, isolation, and harassment are all real hazards in the workplace and should be treated equally as a danger to workers. PPE are wearable safety measures to ensure the proper handling of your work and environment. Having the knowledge on what equipment is needed for the right job is crucial. For example, knowing what type of gloves to use depending on what you're working with, ear protection based on workplace noise levels, and mask type based on the thickness of debris or dust. PPE works in the right circumstances and should be used when necessary, but using the wrong type of PPE can sometimes be just as bad as none at all. To learn more information on proper PPE usage, workplace hazards, your rights as a worker, and more, visit www.wcbpeca.
So this video was produced by Zoe Sharpley from Charlottetown Rural High School in Charlottetown, Prince Edward Island. Congratulations, Zoe, on taking home the $1,500 second prize. And your school, of course, will also receive a matching prize. And lastly, we play the first place winning video entitled Maintaining Effective Communication in the Workplace.
Alberta as we know it has a powerful workforce. However, when Alberta's lines of work are narrowed down, it's all dependent on the everyday workers. What is the one thing that jeopardizes the safety and productivity of employees? This is what we're going to talk about today. Hey guys, my name is Jacob, and after this video you will know how to maintain good communication in the workplace. There's an issue that needs to be addressed whether you're working in shops or other labor areas, and that is communication. It doesn't matter what field you work in, whether it's mechanics, welding, butchering, or even cooking, good communication is key for workplace safety. Number one is to have laid out instructions and safety precautions before each and every task. Without this, workers may assume variables which could be unseen risks. This can also improve efficiency for workers since they know exactly what they are doing for the working day. Number two, the majority of communication is not spoken. Make sure your materials and tools have the proper labels by which they explain the uses and the dangers of those material or tools. And finally, number three, if something looks unsafe or hazardous, let your employer know immediately. Don't be shy, because if you don't let your boss know, the result could be either harmful to you or your coworkers. Also, employers check up on their employees on a regular basis throughout the working day, assuring that everyone is safe and productive. That's it for me, guys. Stay safe out there.
And it gives me great pleasure to announce that the first place winner of the National Youth Video Contest is Micah Griffin from Olds Koinonia Christian School in Olds, Alberta. Micah and his school will also receive a $2,000 prize. Congratulations, Micah, on this outstanding production. Now, before we close, I want to acknowledge our panel of very busy judges for their time in evaluating the videos. Thank you to Brandon Miawasigny, Vice President of Communications and Marketing at Inspire, Chelsea Wong, Youth Mental Health Volunteer and Advisor at Youth Mental Health Canada, Daly Kofi, Program Officer of Communication and Information for Canada Commission for UNESCO, and Jonathan Paredes, Alternate Young Workers Representative for PSAC Regional Council. And thanks to all of you for spending some of your day with us. Safety and Health Week is only 1 week, but our commitment to creating workplaces that are physically and psychologically safe must remain strong every day, all year long. I encourage you to participate in the activities planned for this week. You can register using the link that's been shared in the chat. On behalf of our guests from Threads of Life, Health and Safety Professionals Canada, and our staff, let's make this week impactful and inspiring. Thank you so much for joining us.